So next is Dr. Kanika Chhabra. She'll be presenting on RetiSurge, a model eye for dry lab training in vitreoretinal surgery. And it will be discussed by Dr. Uni Krishna.
Good morning, everyone. Today I'll be discussing about RetiSurge, which is a model which we designed for early vitreoretinal training. Slides on. Slides are not moving. Correct. So as we know, vitreoretinal surgeries are complex surgeries where we need the focus of the retina with the visualization system, along with manipulation of instruments in an enclosed chamber. And novice surgeons face a lot of challenge in this. We had the traditional approach, which was observing the competent surgeons and then directly attempting onto the patients. Second was the animal eyes, but they have their own limitations like availability, need for separate instrumentation, and poor visibility. Then simulators, though they are a great tool, but they are expensive and not readily available. Recognizing the limitations of all these approaches, we designed a simple, cost-effective model designed via 3D printing. So how is the model I made?
Is designed using 3D printing. An eyeball is sketched based on its anatomy, which is then incorporated into the CAD software with appropriate dimensions. The model consists of two hemispheres. The upper one is made up of flexible material, that is TPU, which has same tenacity as that of human sclera. The lower part is made up of PLA. Preparation of the retina. A color printout sheet is folded into a hemisphere using the concept of tape comb wrapping. A 3D printed tracer is used to customize the fundus printout so that it fits perfectly into the eyeball model. For a realistic fundus image, it is printed on a PETG sheet and then shaped with thermoforming microscope handle cover is fitted into a cardboard box with a hole in the center. The model eye is then placed over this assembly. Two ports which simulate the superior sclerotomies are made in the eyeball using the 23 tricars. These ports allow the introduction of the instruments into the posterior segment. This assembly is then used in conjunction with the operating microscope fitted with the biome to visualize the posterior segment and practice various steps of VR surgery.
Now
The
coming
most
on to the
important
applied
aspects
aspect.
of VR surgery is the focusing and adjustment of the microscope to obtain an optimum view of the retina, especially the periphery. Beginners face a lot of trouble in this aspect, but it can be overcome with practice using this model. Manual dexterity is the basic skill required for all VR surgeries. This model helps the trainees to achieve the desired flexibility of the non-dominant hand required for performing bimanual maneuvers during these surgeries. RetiSurge can also be used to practice the basic component of core vitrectomy, that is illuminating the retina and the vitreous to be removed without losing the focus of the microscope. Endolaser can also be practiced on this PETG film. The burns resemble those on the human retina, and the power settings are comparable with the real life scenario. Further, it helps beginners in developing the sense of awareness regarding the position of instruments inside the eye to avoid inadvertent complications like retinal touch.
Come on to the advantages. It is an economical model prepared from indigenous materials which were available in our hospital. It was reusable, could be sterilized by using ethylene oxide, and since there is no biological tissue, it can be used inside the regular operating room. Limitations include it cannot be used to practice all the maneuvers and simulates the fundus view of an aphakic eye. It has already been published in AIOC in 2021. Thank you.
Thank you, Dr. Kanika. Dr. Nair, please.
That was it's a really nice innovation, especially for an early training in VR surgery. As long as we understand its limitations, what you can do, what you cannot do. I'm most interested to know how is the focusing. it's an aphakic system. How is the focusing? How is the visibility to the periphery using?
So the periphery focus is as similar to the routine normal eye, but yes, that aphakic thing which you're mentioning, as I mentioned, the limitation also, because we tried implanting an IOL inside, but we were unsuccessful.
Okay, and how is the depth perception when you go to the the so-called posterior pole here? Could a trainee pick something off the surface?
Yes, we attempted glue also. So for ERM, we are actually, the next would be that we are attempting to place a glue, and then with the forceps, we are planning to do an ERM peeling. And the next is that
Okay, so
we are working on it.
I saw a very elaborate tape around it to stabilize it on the bed.
Sir.
How difficult is that, and is there mobility issues?
Yeah, the mobility is there because if the plaster is little loose, the entire assembly moves. So that has to be ensured that it's fixed properly and before we start, sir.
I think it's a very brilliant way to start VR hand movements before you go into the surgery. Yeah.
Especially the non-dominant hand part, because the early surgeons, the fellows especially, find it a lot of difficulty to use the left hand. I myself was in trouble, and then thanks to this device, I was
That's good. Thank you.
Any other comments? Yes.
Do you fill the eyeball with some gel?
Yes, sir.
What is the
viscoelastic, sir?
But viscoelastic, will it simulate vitreous?
Sir, actually the cutting is not there, but the illumination part, as I mentioned, like initial days when I was struggling with the focus part, that illumination with the use of the left hand, the light pipe, I was getting stuck there. So this helped me illuminate it better, and both the hands, the coordination of both the hands could be practiced.
So one thing that can simulate vitreous, but it's a bit dicey taken, is egg white.
That's what
egg white so we cannot take it inside the operating room. We thought so, but
egg white is something, if you can
Cutter was cutting it also. We attempted in the wet lab, but we could not take it inside the operating room. And the microscope and the machine cannot be taken out. That's why we shifted to viscoelastic. It was safe to use inside the operating room as well.
Okay, thank you. Thank you so much.